Good afternoon. This is the Thurston County Board of Health. This is Tuesday, March 14th, 2017. I'm Commissioner Bud Blake. I'm the chair of the Board of Health this year. I'm going to start off by doing introductions. To my left is Commissioner Gary Edwards, and to my right is Commissioner John Hutchings. To his right is Clerk of the Board Lydia Hodgkinson. And to her right is Art Story, the Interim Director of the Public Health and Social Services. With that in mind, I'll call the meeting to order and then ask for approval of the agenda. Take a motion to approve the agenda.
Mr. Chair, I move to approve the agenda.
I'll second that.
It's been moved in second to approve the agenda for March 14, 2017. All those in favor say aye.
Aye.
Aye. Motion carried. Aye. Motion carries. Okay, and then I'll look for a motion for the minutes on January 10th, 2017.
Mr. Chairman, I move to approve the meeting minutes from January 10th, 2017.
I'll second that.
It's been moved in second to approve the meeting minutes for January 10th, 2017. All those in favor say aye.
Aye.
Aye. Motion carries. So at this juncture of the program, we have the opportunity for the public to come to the podium and address the board. And I
Anyone?
don't see any sign-up sheet. Is there a sign-up sheet?
Anybody on it?
Okay, so I'll just look out into the audience and see if there's anybody that wishes to come to the podium and address the board for any particular health reasons. Okay, so we'll just move on to our next item, which we have a department item from Thurston Thrive's Economic Action Team. And I have, is it Mr. Chris Hawkins that's going to introduce this, or we'll give him a second to get it ready. So with that, I think Liz Davis is going to come, and Michael Cade from the Economic Development Council, and I'll let Chris introduce you.
Really briefly, thank you, Commissioner Blake.
Yeah,
Liz Davis will introduce the main speaker for the Thurston Thrives update this month.
you bet, Chris. Thank you. Hello, Liz.
Hello, nice to
afternoon.
see you all. So you haven't had an update in a while from the Economy Action Team.
Yeah.
And part of the Economy Action Team is the Economic Advancement Hub that is shared between the Food Action Team and the Asset Building Coalition. Sorry, not food, economic. Shared between the Economic Advancement Hub of the Asset Building Coalition and the Economy Action Team of Thurston Thrives.
There you go.
And the primary objective of the Economic Advancement Hub is to raise up those in poverty and to give them opportunities to become more self-sufficient. So that's one piece. The other piece is overall economic development and how we can do that most effectively in our community. So Michael Cade from the Economic Development Council is here today to talk to you about ways that his organization is doing that in order to bring about the outcomes of the Thurston Thrives Economic Advancement Strategy Map.
There you go. Very well did.
Thank you.
Hey, Michael, how you doing, buddy?
I'm doing very good. How are you?
Can you lower the mic just a little bit?
I certainly can.
Mic to mic. There we
Mic
go.
to mic. Get mic to mouth. Thank you very much for the opportunity to speak with you this afternoon. Prepared a number of slides. I'm not going to go through all of them. You death by PowerPoint. It's not the intention today. I think what I'd like to do is provide you with a quick overview of how the economy is operating, the work that the Economic Development Council is doing, but there's a great nexus that's going on here, the great connection between Thurston Thrives and the Asset Building Coalition, and there's a movement forward about how do we address the economy in an alignment and work together. Economic development is not done singularly, as I've said years and years and years. I think I finally get it, that it creates partnerships, it takes partnerships, and so really that's kind of the theme of my presentation to you today. I understand I have about 10 minutes. I'll try to zip through about 4 slides. I'm going to leave the rest of the slides to your leisure. I'm sure it's some light reading that you'd like to do. I know that I love to read about economic development when I can't sleep at night. So the first thing I like to do is pause at this slide and really talking about really what is a vision for working in alignment. As you can see, the words on there is a mouthful. What it really means is that we're going to work together, is that we're going to work with our agencies, and we're going to make sure that those partnerships exist to create an opportunity for the citizens and the communities of Thurston County. The economy has changed pretty dramatically in the last 5 years. As you know, 10 years ago, there was about 60% of our wages were earned in the public sector. That's flipped. About 60% are now earned in the private sector. And so where those jobs are earned and where that income opportunities are happening, that's really what the crux of the matter is, to create that wealth in the environment, create that wealth in the communities. So as you read through the Economic Alliance strategy and the vision statement, there is a notion that we can have a long-term sustainable effort for promoting and increasing wealth throughout Thurston County. Purpose really is the identification of where those connection points are between agencies. And so we actually have mapped out those connection points. Go back to actually the work that was done for the Sustainable Communities Project through Thurston Regional Planning Council. We wrote the Sustainable Economy chapter. There's a direct DNA link between that work and the work that was done on the map that you'll see in just a minute. I'm going to put it up here with Thurston Thrives. And then there's another link directly to the work that we're doing at the Economic Alliance. So why is it time to do it? Why not? You know, now's the time. Now's the time. Geez, you know, we've been working in this community for 14 years. I really love Thurston County. There is unique opportunities in this community, and there's a better opportunity for us to work together. Now's the time. We know what our clusters are. We know what our major drivers are. We know those impacts. We know the downstream impacts of jobs and employment. I know that if I add 10 jobs in manufacturing, I'm going to add 12 other jobs from the economy. That's the kind of the metrics that we're doing it. So we have that data and we have that analysis that we can kind of give to you on a regular update. This next slide is I always title it From Chaos Comes Order slide. There's a lot of stuff there. But we've identified, we're basically in 12 spheres of influence, what we need to address. We can't do everything. We certainly can't do everything on that slide, but we can do some of it. And we're endeavoring to do about half of it. And so I'm not going to go through every one of those, but if you look through all those, there's about 55 different data points on there. Mm-hmm. We've addressed about half of them so far in this last 2 years, and it's been pretty cool.
Okay.
This next slide really is where I'm going to stop and kind of chat a little bit about the economy strategy. It was last week I had the opportunity to speak at a rural health network, talking to some folks up in SeaTac about what's the impact of the health, what's the impact of hospitals have upon economic development strategies in rural communities. So I put this slide up there. And I talked a little bit about it and working backwards. You know, the goal is people are economically secure, poverty is rare, and so what are the if-then statements? So what? How do we get there? We create jobs. How do you create jobs? Well, we create jobs by having an aggressive recruitment standpoint. But we also create jobs where we create opportunities. You think about their asset building coalition, what they've actually done, interesting enough, to add dollars into the economy. I'm not really a buy local guy. I get it. I understand why you have buy local initiatives. But I'm also about adding dollars into the system. Through the Earned Income Tax Credit, last year we added about $1.75 million into the local economy. This year, or actually that was 2015, 2016, we added just over $2 million in tax refunds. If you do those multipliers out there, that equals to about $6,735,000. That was not added, that was not in our economy before. And if you take that transference, if you just do a multiplier for the full-time equivalent jobs, that equals to about 122 FTE jobs. So when you work backwards through that slide, you find out, are people truly economically secure? Do they have opportunities? We need to add dollars into the system. Last year, we've added about 225 new jobs net in Thurston County. That's new employers moving to the area. We also attached ourselves to about 3,000 business entrepreneurs. We launched about 115 new businesses in Thurston County through our resources, and it's pretty phenomenal stuff when you do the multipliers out. We are having an impact. The idea there is that we are not necessarily just adding jobs at one edge of the scale. Economic development is about paying attention to the full thermometer of scale. So you have jobs that are entry level and exit level. We want to pay attention to that as well. Employment population trend lines indicate a need to create jobs. This is the one that I'm going to stop at, and then I know I've kind of burned through my 10 minutes, but this is the one that I want to stop at and really talk about a little bit. So right now we employ an unemployment rate of 5.5%-ish. You know, don't take that one to the completely bank because that's changed. We have a total employment base of about 110,000 people. So we know what our population increase is going to be. Thurston Regional Planning Council does an excellent job about forecasting. In fact, of all the regional planning councils in Washington State, they're usually the closest of those projections, and they usually get it, bam, man, I don't know how they do it, but they do a good job. So we know what our population could be or should be by the year 2040. So all things being equal, we have to do a better job about creating those opportunities. So if you think about it, we have to create about 55,000 new jobs between now and then. We're not getting there. No, we're not getting there at all. And that's what I lose sleep about overnight. And so when you go back to this model, where those job creation and where those networks create is very important. Workforce Development Council is a big part of our world. They're creating systems where employers can now talk to each other about sharing resources. We've launched a pipeline of internships, so individuals, young people, can find those unique job experiences. We actually have a little stipend at the end, so when they get done, they get about $1,500 in their pocket for doing a 9-week internship. 3 community colleges are working. We're going to launch a research institute that we can actually work with the community to define what is important. We're also created that Center for Business Innovation. That's a big part of Thurston Thrives. That was part of that work that was identified early on with the sustainable communities, and how do you launch and sustain those businesses. We also launched Think, Thurston Investment Network, of hooking up businesses with folks looking to fund a business and folks looking to fund a business. So we're a matchmaking service. We launched that last month. It's been fantastic. We've already trained 75 individuals going through that system, and they're starting ready to make those deals. So there's opportunities. We've set the table. We've got a bunch of other stuff going on. We're heading off to China on Thursday to look for foreign direct investment. I'm not afraid of that word at all. I think it's important that we kind of expand that opportunity. Thurston County, we received about $45 million of economic impact for our organization last year alone. We know where it comes from. We know what we do. The one thing that we better do pay attention to, and I'm just going to leave this as a challenge, not necessarily to you, but to my organization as well, is that we have to pay attention to those indicators and those indicator jobs and employment. We know that right now it's food, plastics and chemicals, it's tourism, it's IT telecom, it's healthcare, it's tourism. Those are our main drivers. But we have some new and emerging sectors that we need to pay attention to, that we have systems in place to support them. And we're doing that. So we've created that problem, those opportunities. I think I'm kind of burnt through my time. I know it was quick.
No.
I wanted to give you a look-see as to kind of how those 3 things are working in integration. When economic development happens as a partnership, it is a beautiful thing. It is a good thing. You're not standing out in a field by yourself. You're looking for partners. You're out there with some folks thinking about doing some stuff. I want to thank you for your support also. The Thurston, the Tenino Agriculture Industrial Park, we're still in play for getting that funded. And again, that isn't about just new production. Those are about how do we turn those crops and those produce into products. New markets for new products for new markets, and new products for old markets is the saw there. So thank you. And questions, comments, criticisms,
Gary's got a question.
love dialogue.
Kind of fun to watch your enthusiasm. Thank you.
Thank you. I think I have, deference to you, I think I have the best job in Thurston County, to tell you the truth, so.
No pun intended, it's a job. As you were going through your presentation, Mike, I was jotting down questions. You hit every single one of them.
Good.
With the exception of, but you did talk about the entry level versus the exit jobs.
Yeah.
And how many we have and such, and we need to increase those. But is that all the way up and down the spectrum, or do we need more mid-range or the top scale?
We've done a very good job of creating those entry-level jobs. We have done a very good job of creating those entry-level jobs. We need to create those high-wage, high-value jobs.
Okay.
And I'll say it, we need to create those jobs that create wealth. We need to move those folks from that entry level into those mid-level and upper ranges. We have a very thin upper level. Our economy is very thin at that top level. It's very thick at the bottom level. And we need to do a better job of moving that upwards. So,
Got it. Thank you, sir.
yeah, you bet. You're welcome.
Doing a good job.
No. I too would like to thank you and those from the EDC and on the, well, what you've done with the Asset Building Coalition as it relates to Thurston Thrives. It's a critical part of building a healthy community for people to thrive and prosper. And without your efforts, as far as keeping an eye on the pulse of what this economy is here in Thurston County, we'd be lost without you. So thank you for what you do.
Thank you very much. I
bet.
appreciate it. Thank you.
Yeah. Okay. Next department item we have is going to be substance use prevention and treatment in Thurston County. And we have a host of people, Mary, and I think Chris is going to announce them, so I'll just let him, and we'll take it away from there.
Thank you, Chairman Blake.
You bet.
Chris Hawkins, Community Engagement, Evidence, and Partnerships Manager with Thurston County Public Health and Social Services. And I just wanted to mention quickly who's here to speak with you today about substance use in our community, particularly substance use among youth. We have Marianne O'Garo from Thurston County Public Health and Social Services to give you an overview on prevention and the full spectrum of things related to substance use. And then we have Sarah Ellsworth to speak with you about tobacco prevention efforts in the community, and Jonna Knower from Together, and she's going to speak with you about youth marijuana prevention and education here in the community. And then we'll round out the presentations with Joe Avalos from the Behavioral Health, Thurston Mason Behavioral Health Organization.
Yeah, super exciting work. Do you have a slideshow you want to put up on the monitors?
It's an all-star cast.
Huh?
All-star cast.
Oh, I know. We got a great team today. Hi, Marianne. Welcome back.
Thank you for having me back.
Yeah, love hearing what you have to say.
Okay. Well, Chris is getting that going. I'll just start with, again, I'm Marianne O'Garo. I'm an epidemiologist with Thurston County Public Health and Social Services. I really appreciate you taking the time to talk and learn about this important subject, because I know there's many people in the room who have been impacted by substance use in many ways. They have personal stories. Mine is, as many people, I've had several. One, I have been hit by a drunk driver. I'm not the only one in Thurston County. It brings home the importance of treatment. My mother smoked cigarettes, and unfortunately that meant that she died before she got to see me graduate from college, because she got one of the diseases associated with that. And I am so not alone in what that means and does to families, children, and communities. So I just wanted to share that with you, because I know there's many people in the room and in the community that have these experiences, and we so appreciate the effort people make to try to prevent and treat and work with folks to make a difference. I'm going to start with this particular slide, which is a little busy, but I'm going to explain the components of it. When we look at substance use prevention and use and treatment issues, we look at it as, at least from the health department, it's a public health issue. It's a significant public health issue. It's a leading, what we call, actual cause of death and disability. And when we look at issues from a public health perspective, we considered a wide range of health issues that affect the community. There are many things we could be working on. There are many topics that are important and that impact local residents, but we do try to focus on things that have a substantial impact on populations and or whose consequences are grave for health. We also look at this concept of actual causes of death and disability. And what I wanted to share with you about that is when you look at something like, for example, a death certificate will say cancer. That's a cause of death. It doesn't say tobacco. When you look at a death certificate, it may say liver cirrhosis. It doesn't say alcohol use. So when we think about this scientific concept of actual causes of death, which has a long history of research, substance use comes up in the top 10 consistently. So in that list, tobacco use is considered the #1 actual cause of death. Alcohol consumption is considered the 4th, and drug use is considered the 10th. Other examples of actual causes of death would be physical activity and nutrition, sexual behaviors. There's some other things that are in there, but that top 10 list, substance use takes up 3 categories of that. So significant from a prevention standpoint. When we also look at priorities to address, we consider some things in public health that sometimes you don't think about. We consider whether the issue is something we can make a modifiable or actionable change in. Can we even do anything about it? Is there science there that tells us how to address this? Some things are genetic. We may not be able to do anything particularly about that, but other things are a combination of issues together that we can address. And substance use is one that's modifiable and actionable. Therefore, I just included in this, it's small, but it's what they call, this particular model's been around for a very long time in terms of how to address health. It was originally called the Institute of Medicine Protractor, or Gordon's Arc. And then over time, it became the Behavioral Health Continuum of Care with additions. And when you look at this particular model, public health action tends to be in the blue categories, and treatment agencies and organizations that work with recovery and treatment tend to be in that white category. So when you see on there promotion, many things that we do in the community are around promotion, and you'll hear some of that today. When the other presenters come, promotion is that concept of we're trying to make the conditions in the environment supportive of preventing use. It's more like community focused. Prevention is something that we're trying to do before onset of the issue. Treatment is delivering it to those diagnosed, and recovery is helping those who've been through treatment live without substance. So in Thurston County, what I wanted to share with you more, generally, this is true for adults and youth, but generally I was looking at the youth statistics. What we know in Thurston County about the youth currently as it stands, based on the Healthy Youth Survey, which the most current data is 2014. Tomorrow, actually, 2016 data comes out. So we'll see if these trends hold true and how true they hold. But when you look at this list of 4 substances, that's kind of the order of common use. Alcohol is used at a higher rate than marijuana, higher rate than cigarettes, higher rate than abusing prescription drugs. And those numbers, I just wanted to provide you just to kind of give you a feel for if you were to look at 10th graders, sophomores in our high schools, what would that figure be? So a 10th grader in Thurston County, about 22% use alcohol currently. And that's actually decreased over time. There's some good news there. I sure hope it still is. Yeah. For adults, about 17% of county adults binge drink, and about 7% engage in heavy drinking. So high for those folks as well. Marijuana use among 10th graders is about 20%, so a few percentage points lower than alcohol. Adults, about 15% of Thurston County adults currently use marijuana. Cigarettes, and marijuana stayed about the same for use over the past decade. For cigarettes, we have seen that number decreasing over time. Much effort has gone into decreasing that number. And for Thurston County 10th graders, cigarette use, so not counting vaping and all the interesting concerning trends around that, about 9% of 10th graders use cigarettes currently. Prescription drugs. Yeah.
How much percentage? I didn't catch that.
For cigarette use, it's 9%.
9. And then do you have any additional information on vaping for him?
Vaping, I don't have in front of me, and they vape both tobacco and marijuana, but I can sure get that for you.
I just wondered how it fit.
It's a little bit higher than cigarette use, though, I can tell you that. Prescription drug use, so abusing a painkiller is at 5% for 10th graders, but abusing any kind of prescription, things that they get a hold of, is actually 8% for 10th graders. So we are concerned about prescriptions of all kind, as well as those that create a continuum of addiction. And when we look at where particularly our youth kind of getting these from, when you look at alcohol and marijuana in particular, the pattern tends to be, first they get it from their friends, parties, next step, then they give money to someone to get it for them, and then they take it from home either with or without permission. So when you look at some of the things you've done recently, you're impacting some of those sources and issues directly. And since my time is done, I just wanted to share with you, as I mentioned, that 2016 Healthy Youth data becomes available tomorrow. We'll be taking a look at the trends, what it means for vaping, what are they vaping, what numbers have changed and what does that look like. And we'll also be sharing some of that information on our website and through some other sources. But next up is a whole series of wonderful presentations on that prevention and treatment continuum for you to learn more. So thank you.
Any other questions for?
Thank you very much.
I do. Just real quick, going back to the slide of alcohol, marijuana, and cigarettes, and there's chatter about raising the age of, for cigarette purchase to 21. Any idea where that's going, or whether
I-
that'll go anywhere?
I have not heard. I know we were tracking that legislatively. Do you remember?
Yeah, I'm not sure what the current status of that bill is.
Okay.
Yeah, that's been an interest for some time.
I think it might, because it has a potential impact on budget, I think it's still alive, so it's one of those things. So but I will check on that and find out for you.
Okay.
Yeah, that'd be great.
Good question, thank you.
Any other?
Thank you, Mary Ann. No.
Okay, so I think the next one is Youth Marijuana Prevention and Education Program. Is that
That's right.
Okay, great. There you go.
Hello.
Hello, Jonna.
I'm Jonna Canor. I'm a program director at Together. Today I'll be talking to you about the statewide Youth Marijuana Prevention and Education Program. It is a partnership across multiple agencies to prevent marijuana use in Washington State. So as I mentioned, I'm a program director at Together. Together is a nonprofit agency located in Tumwater that works to advance the health and well-being of all young people. Together is one of the subcontractors of the Youth Marijuana Prevention and Education Program. It's a mouthful. Matthew Shellhart is the program director of that program and unfortunately couldn't be here today, but thank goodness he put together this presentation for me to present in his absence. So as I mentioned, the Youth Marijuana Prevention and Education Program is a partnership with agencies across counties to work on the prevention of youth marijuana use. Choice Regional Health Network is a regional nonprofit collaborative of healthcare leaders that supports the 7-county accountable community of health called the Cascade Pacific Action Alliance. And this is made up of Grays Harbor, Mason, Thurston, Pacific, Lewis, Wahkiakum, and Cowlitz counties. We are not the only group of counties that are working on this grant. As you can see on this map, it's the whole state of Washington that's been divided up into 9 community grantees that are all working together on this program. So when voters passed I-502, it stated that a portion of the tax dollars should go to substance abuse and prevention. So the Washington State Department of Health put together the Youth Marijuana Prevention and Education Program to increase awareness about the associated risks and the consequences of marijuana use by youth. So some of the program goals for the Youth Marijuana Prevention and Education Program is first to identify the needs in the region. So needs assessment was done at the beginning of the program and will continue to be done every year. We're also aiming to improve the environment and systems of marijuana use, as well as enhancing community partnerships and engagement. 3 populations have been identified as a priority for this program, and that includes American Indian and Alaska Native youth, youth who are struggling in school, as well as Hispanic and Latino youth. So for a quick overview of the program, our region, the 7-county region, is working on enhancing substance abuse prevention programs that are already existing. And then we're also working on strengthening the community and regional networks. What's been really awesome through this partnership is we can see what other counties across the region are doing and really just pull from them. There's been examples of really awesome things happening in like King County, and we can just reach out and say, hey, can we get that resource, and we can start it down here, and vice versa. So instead of recreating the wheel, really having this partnership has been extremely helpful. We've also been working to implement some training programs. So examples of these are Strengthening Families. Strengthening Families program is a 14-week family skills training program. We've also done High in Plain Sight. That is a training that talks about drug trends across the nation as well as local to our area. We've done life skills, which is an evidence-based curriculum that can be taught at schools or in after-school programs that has substance abuse prevention outcomes. There was a culturally competent and beyond training. We're working on social norms, positive messaging campaigns, and I'll talk a little bit about that on the next slide. And then the art and science of community organizing was another training that has been put on through this program. So a little bit more about what's happening here directly in Thurston County. That last slide was the ones that are happening in the 7-county region. All of the schools in Thurston County have been provided with updated signage that now talks about the new laws. So, before it used to say this campus is a tobacco-free school campus. Now they all have signage that include marijuana and vaping. On here it says that social norms are happening in 2 schools. I kind of want to talk a little bit about this point. So Together has been running social norms campaigns for many years now. We're actually in 13 schools. This funding source pays for 2 of those schools. And basically what this does is it follows the social norms theory that says as human beings, we behave in ways that we think others are behaving. So if we think that it's common for everyone to use marijuana, we're more likely to use marijuana. So what happens in this is we survey the kids, we find out the number of kids who are actually using marijuana, and then we celebrate the opposite of that. So if there's 98% of students who aren't using, we create posters that get hung up saying just that so that people can reduce that perception of use and also increase the perception of harm. Together is also doing a pilot program for a marijuana education toolkit. We've been finding that middle school teachers especially are really lacking a lot of the resources in order to teach marijuana. So we're putting together a toolkit that will have everything that they need to be able to teach their students, and it'll be readily at their fingertips to implement. We've already talked a little bit about the Strengthening Families program, and the last thing that's happening through this program in Thurston County is really collaborating between all of the already existing coalitions and making sure that marijuana prevention is on their top priority for their prevention planning. So some of the long-term objectives of this program are to decrease the percentage of 10th graders who have used marijuana in at least one of the last 30 days. The second objective is to do that exact same thing, so reduce the percentage of 10th graders among that priority populations that we're really focusing on. And then the third objective is to decrease the percentage of 10th graders who first use marijuana before the age of 14. We are currently in year 2 of this program, and we're gearing up for year 3. Year 3 is really going to focus on the policy, systems, and environments. A really great thing about this is Thurston County is kind of ahead of the game. One of the things that recently happened, thanks to the Board of County Commissioners, was a social host ordinance was passed last month. This was the first ordinance in Washington State to include marijuana, and this is exactly the thing that this program is going to be working on. So we're going to be encouraging other counties, other regions, to be following Thurston County and implementing these type of policies, and really doing that systems change and environment to make sure that these policies are known about in the communities, doing that education piece as well. We're also going to be doing some retail scanning, retail education, as well as youth leadership development. What we're finding is that peer-to-peer education works really, really well. Students want to hear from people their own age, so we're really encouraging youth to take a stand and educate their peers, make their voice heard, and stand up against marijuana use. So I think that is all I have for you today. On the screen is Matthew Shellhart's contact information. He is the go-to man for this program, so if you have any questions, please feel free to reach out to him. In the meantime, I can answer any questions that you may have right now.
Nope, not yet.
Thank you. Just a quick one. Is Together a great organization or what?
It is.
And given the limited time you had, you did an excellent job at speaking at freeway speed. So I'm looking at, when you go back to the program overview, you don't have to go back. You talked about the art and science of community organizing. What does that mean?
So that was a 5-day training that's basically educating people on how to organize groups of people to work on prevention efforts. Like, how do you take a whole community and move forward and work together, do some of that collaboration to really drive the point home. We know, that cliche, it takes a village. We need everyone's effort. So how do you really engage people from all different walks of life and aim towards the same goal?
So use some of that to get the social hosting ordinance out.
Yes.
Okay.
Exactly.
Thank you.
Thank you.
Anything else?
No, Erlis started a pretty good program, I'd say.
Yes,
She
she
did.
certainly did. Yes. I'm so thankful to be able to work them. It's a wonderful organization. Thank you.
So I'm a numbers guy. If I needed more data points, is it contact Matthew? Would that be a good start? And-
Yes, that would be a great start. Mhm.
Okay. Thank you
Yeah.
so much, John.
Yeah, thank you.
Thank you, Jonna.
Thank you.
Tobacco prevention. Hi, Sarah.
Hello, good afternoon.
Hi.
I am Sarah Ellsworth. I am the Behavioral Health Clinical Services Manager for Capital
Sarah,
Region.
can you
Oh,
hold
you
the
want me
mic
to
up?
move it up?
There you go, right there.
Is that
There you
better?
go. Perfect.
For Capital Region ESD 113, we serve a 5-county region that includes Thurston, Mason, Grays Harbor, Pacific, and Lewis counties. The slide that Marianne put up there earlier, I wasn't expecting, but it's great. But our organization actually provides the spectrum of services from prevention through to that recovery supports. Today specifically, I'm going to be here talking about our tobacco prevention efforts targeted at youth, but our organization as a whole really serves that gamut of comprehensive behavioral health services, both substance use and mental health now as well. So when we talk about why do we want to address tobacco within our community, why do we want to work on prevention, Marianne did a really great job of laying that foundation for us, but we know that tobacco is the #1 preventable cause of death and disease in our community. And so you can see up there 90% of lung cancer deaths, 45% of heart disease. You can read those statistics. I don't need to do that for you. And so primarily the focus of ESD's tobacco prevention efforts are around youth tobacco prevention. The goals that we are trying to reach are to prevent youth initiation, so stop youth from actually starting to use tobacco products, provide education to the community about trends and use amongst youth, and reduce the number of children who are exposed to tobacco and vaping devices. And I'm going to talk about some of our strategies for doing that. So one strategy is our Miss Washington Media Awareness Projects. ESD 113 has a partnership with Miss Washington to provide education to students about the dangers of tobacco use. There are two sorts of ways that we approach that. One is schools can arrange and have Miss Washington come and do the presentation herself. She talks about social norms, how messages are spread about tobacco use, the dangers and that sort of thing. That's one way to do it. The other way is she works with local groups within the community and she trains those students to then go back to their schools and deliver the prevention messages. So she can do both of those things. In Thurston County, specifically Rochester and Tenino have already had Miss Washington do this presentation to their students. There are planned presentations for Evergreen Christian and at North Thurston, Camachan Middle School, Nisqually Middle School, and River Ridge High School, and we're continuing outreach to our other districts who are interested. The other thing we've done that it was actually in partnership with the Youth Marijuana Education Program is offering the high and plain sight training with Officer Jermaine Galloway. If you're not familiar with that, really what he does is lay a foundation for tobacco and marijuana trends in our community. So what he's an officer out of Idaho, Boise, Idaho, I believe, and he talks about trends within the community, concealment methods, kinds of things that parents, educators, other people who interact with youth might look for evidence that substances or student is using a substance. He also does a really cool thing where he comes out early and does kind of a scan, goes to visit stores in the mall, visits our marijuana shops and things like that, and adds some local flavor about what's actually happening in our community. We had a training earlier this month at the ESD. There were 70 people in attendance. A good majority of those were school staff and educators. There was also a large contingent of nurses. I think some law enforcement was there as well, but we had to actually, there was a wait list and we couldn't let everybody who wanted to attend.
Good. Good problem to have.
Yes. The next one that actually I'm super excited about has been a long-term project with Thurston County, but the Thurston County Lockbox Project, which came about, I think, 3-4 years ago in partnership with our partners at the County Health Department, talking about some of the things that they were doing in their nurse home partnership, which is really, they were noticing a lot of their parents were using tobacco products through vapes or marijuana products, and that those weren't adequately secured from their young children, and so they wanted to do something to help address that. And so we came up with this idea of lock boxes with the goal of preventing child poisoning by tobacco or vaping devices. We know 84% of e-cigarette exposures are in children 1 to 3 years of age. That's really concerning. And so we were able to develop this project. Our partners at the health department developed some education and cessation resources that go inside those lock boxes, and those are delivered through the Nurse Home Partnership to have a secure way to lock those up. What I think is really cool about this is the impact that it's had far beyond Thurston County. As Jonna mentioned, with youth marijuana prevention and also with tobacco prevention, we have access to our other providers across the state, and we share resources. And so the resource that was developed here in Thurston County has actually been spread across the state, and they've modeled several other projects such as this, where they're passing along information in that way, all by stuff that was developed locally. So that's super cool. The next thing that we're working on is upcoming, but a countywide tobacco and vapor product forum for schools, community partners, and policymakers. This is also being done in partnership with the Public Department of Health. Kateri Wimsa is the one who's sort of in charge of that, and it's planned for May 2017. And then finally, I just want to make sure that you're aware of efforts that are happening outside of the ESD region and within your community. But there are efforts within the health department to prevent youth initiation by providing education and policies. There's an option for cessation for adults either through insurance or Medicaid, and using the quit line, and that there's also a lot of work that's happening to reduce secondhand smoke exposure. So
Great.
that's all I have.
Yeah, question? Yeah.
Back at one of your earlier slides, you had something about with infants, death exposure or something. What is like your second slide?
Yes, so it was talking
was
about e-cigarette exposure, and I think presentations to the ER and the poison control. 84% of e-cigarette issues are in children
It
ages
might have been
1
just
to 3.
before that. There was another one.
It's not
I
that one?
think. No.
Okay.
Right there. Newborns.
Oh.
That's what it was. I didn't understand what that
I would
was.
defer to Mary Ann, but I think that smoking is one of the risk factors for SIDS, and I don't know if that's what they're including or secondhand smoke exposure in newborns. Do you know?
I would have to say the source of this, but in general, the cigarette smoking rate in Thurston County among pregnant women is extremely high, and it contributes to low birth weight, prematurity, as well as other, so then therefore the baby's not fully mature and has more complications, so therefore you see deaths you wouldn't otherwise see in the babies. So that's why it's so important.
Okay.
And if a parent wanted to get, or a family wanted to get a lockbox, how would they do that? Because they're being distributed by ESD?
Through the Nurse Family Partnership,
Okay.
or they could contact Stacy Mueller specifically, who manages our tobacco prevention efforts. If they're not engaged in the Youth Family Partnership, we could probably find a way to get them a lockbox.
Okay, thank you.
Yeah, or the
That
Nurse
was my
Family
question.
Partnership, excuse me.
So I was just gonna ask, is it Nurse Family Partnership handing
Yes.
out the boxes, or do somebody at the house supply their own? But I guess it can go either way.
Yes.
Sure. All righty. Thank you so much, Sarah. Very, very informative. Appreciate your work.
Thank you.
Now we have Joe Avalos, Substance Use Disorder Trends and Treatment Resources.
Okay.
Yeah.
Good afternoon, Commissioners. My name is Joe Avalos. I'm with the Thurston Mason Behavioral Health Organization. And I'm going to talk today about what happens when, despite our best efforts with prevention and education, we still have folks that develop substance use disorder and need to get treatment and resources for that, along with some of the trends that we're seeing amongst our treatment providers, which I think are pretty interesting as well. So I'll start with the very basics. Substance use disorder, or SUD, is really now the catch-all term for what we formerly called alcoholism or addiction, and it's just kind of the new term. It is first and foremost a brain disease. It is a disease expressed as a compulsive behavior, meaning when someone develops this, they're going to do anything they can to use or to get a hold of whatever drug or alcohol they can in order to get high or avoid sickness in some cases. despite any negative consequences. So any legal or education or physical or medical consequences, obtaining that drug is the number one thing. It is a chronic, potentially relapsing disorder as well, much like something like diabetes or heart disease. If somebody is not maintaining a good recovery plan or seeking treatment or going to support meetings, there is a pretty good chance that relapse will be part of that disease process. What causes SUD? Well, we know there are a combination of factors. Marianne alluded to genetics. That plays a huge part in determining someone's vulnerability to addiction. And also environmental factors play a key role. You probably have heard about ACEs, or adverse childhood experiences. Certainly childhood trauma, peer pressure, abuse, neglect, all those issues definitely contribute to somebody developing a substance use disorder. And probably a key point, and that's really important here in the theme of this discussion, is early adolescent use. We know that's really key because our brains are developing into our early 20s. The earlier we can get in there and prevent young people from using regularly, the more likelihood we have of halting or preventing a substance use disorder. So a little bit now about some of the trends that we're seeing now. Marianne gave some points about this health use survey. These are just some key points that really impact us around marijuana use and binge drinking among and I'm not going to read those out loud, but one of the things that Marianne talked about is alcohol being the number one drug of choice, as we'll call it, which is true in the health use survey, but among the treatment community, what we're seeing is actually marijuana is number one. Marijuana is was number one before recreational marijuana passed, before 502, and it's still number one. It's the main thing that we see for young people coming into treatment. And some other things we're seeing since the passage of 502, it has to do with dabbing and edibles. So dabbing is really, it's concentrated marijuana, or THC, which is the psychoactive ingredient in marijuana. If you think about marijuana as beer, you can think about dabbing as the vodka of marijuana. So,
Hey, Joe, can you
Yep.
just elaborate on dabbing just for a second in terms of what it is colloquially and
yeah, sure.
what that means? Mhm.
So dabbing is really, it's concentrated THC. It's THC. And Sarah, you'll correct me if I'm wrong on this. It's taking the wax of the marijuana plant and basically concentrating it and smoking that in a way that raises the THC level to up to 4 times higher than what we normally see. And some of the consequences of that are, can lead to psychosis, and that's something we've seen an increase of in the ER. Providence reports that we've seen increase between 2 and 5 a month, if not more. And that's something we didn't see before with 502, because quite frankly, not many people knew how to do that. And now you can find dabs, or you can have this concentrated THC. You can buy that at local recreational stores. So,
Oh, so it's a byproduct that you can buy separately?
correct.
Oh, my gosh.
You can buy
okay.
that. So it's accessible. It's the same thing with the edibles as well. I mean, Marianne talked about the primary ways that some of our young people get access to marijuana is their friends and so forth. Well, with edibles now being prepackaged, it's much more easy. It's much easier to get. Some of the black market or wherever they were getting from before, nobody was, selling pot brownies before 502. Now you can buy them. Incidentally, in just the last month, the Liquor Control Board did recognize that there was some more measures that need to be put in place in terms of advertising, and so now I think as of the end of February, there's a big red hand that's supposed to be on all the packages for edibles to say stop. This is not intended for children. So we'll see what kind of impact that has going forward. Did I answer your question?
Yeah.
On that? Okay. I mentioned about THC levels being up to 4 times higher in your analysis. That's as reported by our providers such as ESD 113. And the consequences of that is that we just don't know what that will do long term. We've not really seen it before. So we already know that marijuana impacts brain development, and so the consequences of long-term use and having these high amounts of THC, we certainly can't be good. One of the other big factors that we're seeing in trends is that there is a nationwide opioid epidemic, and this has been going on for about 10 years now, maybe a little longer, and started as we started to see more prescription drug abuse in the early 2000s with a lot of OxyContin on the street and being diverted or being prescribed in high numbers. And that's led to the number one cause of unintentional deaths in the United States. We have over 50,000 people are dying each year because of this. And I think there are 11 or 12 states, I might be wrong on that, but where opioid deaths, overdose deaths are number one unintended death, and we're one of those states for sure. And so this slide really shows that increase in overdose deaths here, and an interesting trend here. The blue lines indicate the prescription opiate deaths, and you can see the trend there where it's gone up. And then as we started to regulate prescription use over the last 5 years or so, the unintended consequences is we've seen the heroin overdose increase, and that's really what we're dealing with now. We support a local syringe exchange where we've seen the numbers of needles exchanged because of heroin use go up to 1 million a year. We've done some efforts in supporting naloxone, which is an overdose medication, or it reduces overdose. And since we've done that, Dr. Wood's not here to verify, but I think we've done at least 10 or 15 reversals of overdose. So we are taking some steps to try and alleviate that, but it continues to be the number one problem, specifically among adults in our region. So a little bit about what resources are available. At the BHO, our job is really to ensure that there are publicly funded resources available for mental health and substance use disorder. And we've been around since April of this year. And in that time, we've really tried to expand our network from our previous, when we were just the RSN, or the Chemical Dependency Program. And it's a wide scope, wide range of services that we are providing or contracting with providers to provide, ranging from outpatient to residential, detox. We have school-based treatment provided by ESD 113. We've got community-based treatment with many local providers, and then we've got co-occurring treatment as well on an outpatient basis. I know you like numbers, Commissioner Blake, so I threw a couple of these in here for you just to give a comparison of where we are in terms of service. You can see in 2015 how many outpatient folks we served on both adult and youth, and that significantly increased just in the last year. And what we don't know is whether or not it's because we have more available, or if the need is just there. It's really hard to tell yet. We don't know if that's if we've seen a large increase in the number of folks needing treatment, or if that's always there and was just underfunded. We should know that in a couple of years of baseline. So that's outpatient. And here's residential. And this is a pretty key one. You can see on the adult side, we've almost doubled how many folks we've sent to residential treatment, which is kind of, it's a little bit, it's great. It's a great thing, but it's also a little bit scary in that, are these the folks that we weren't serving before? And the increase there with youth too. And then lastly, these are just some of the providers that we contract with locally and regionally. And this list used to be half a page long. It's now 2 pages long, or 2.5. And then finally, I've just got the links to the resources. This PowerPoint will be there as well. And then I'm happy to take any questions.
Yeah, we got 23 questions for you.
All right, let's go. Let's start.
Joe, you just didn't comment on driving impaired. I'm curious how that fits in, maybe not as much with alcohol as it does maybe with other substances. Where are we at with young people and possibly even serious accidents, deaths, that type of thing from usage and driving?
That's a great question. I know that that the Washington State Patrol is certainly looking at impaired driving as one of their initiatives with the Target Zero program. I don't know how much of an increase there's been in that, but I could probably see it'll be a healthy use survey result. So that's
and that'll be available when?
Tomorrow. So
okay.
Get back to you tomorrow with
asked
that.
Today
With that
too
answer.
early. Okay. Well, next time you give us a presentation, that'd
Absolutely.
be interesting.
Joe, the Healthy Youth Survey, that's done every 2 years or 3?
Every 2 years.
Every 2 years. And so the data that we have was done last year, yeah?
Correct. Well, the
And-
data that was in my slide and that Mary Ann presented before was done in 2014.
In 14, okay. Okay, so the new one comes out tomorrow.
Correct.
I'll have to wait as well, because it shows in 2014, 46% of kids thought they view marijuana as not harmful. So I would like to see how that differs.
Right. I would imagine, just to guess, that number's going to go high or up, right?
Yeah,
So
up, yeah.
even more folks will think it's less harmful.
That's my guess. It's a terrible message to send
Absolutely.
to our kids.
Just a comment and to our kids on that note, that the reason why this is important to hear today for the Board of Health is that, to borrow an adage from him, that kids are there's 100% of our population, and 25% of that are our youth or kids. And this is incredibly important to be out in front of it in terms of prevention and recovery if there's a need for it. And with Mary Ann doing the epidemiology of it, you doing the behavioral health portion of it, Jonna doing the together, and Sarah doing the ESD 113. That's just a few in the community doing great stuff in terms of the prevention and recovery if need be. But it's just phenomenal how we still allowed, or kids still get their hands on, I'll pick on marijuana for a second, and it's just it's kind of blasé and taken for granted when we could do some things to help them to grow up to be prosperous and thriving adults, and that's what we're all about, and that's great leadership. And we thank you so much for coming today and presenting today. It really does mean a lot to us. So,
Absolutely.
any other?
Yeah, all of you, thank you. No.
Okay.
Yeah, thank you, Joe. Okay, so our next department item is number 4. And Patrick, is Patrick here? I don't see Oh, there's Patrick. How you doing, Patrick?
Yeah.
Come on up here. We're going to talk about Long Lake Aquatic Nuisance Weed Prescription. Oh, thank you there, Chris.
So I'm Patrick Soderberg. I'm a hazardous waste specialist, but I'm here today as the Integrated Pest Management Program Coordinator. The county adopted an integrated pest management policy in 1989, which was revised in 91 and again in 2014. And it emphasizes non-chemical controls whenever reasonable for managing any sort of pest or vegetation problem. It covers all county departments that are doing work on county-owned or managed properties, but does not cover privately owned properties managed by those property owners. The use of a pesticide, the reason we're here today in front of the Board of Health is because the use of a pesticide in a sensitive environment, to include lakes and water bodies, requires the Board of Health approval. And today, the Lakes Management Program is proposing a prescription, which is like a standard operating procedure of how they intend to control nuisance vegetation within Long Lake. They have been working with the Long Lake Steering Committee, which is homeowners that live around Long Lake area and pay into its management. Through the process of reviewing their prescription, the policy has a advisory committee, which is made up of a group of citizens, up to 9 citizens. Currently, we have 7 members. The members have reviewed this prescription with the staff from the Lakes program, and they determined that the use of a pesticide within this control program is deemed necessary. It's going to be integrated with non-chemical control measures as well, so it's not just a chemical control in the lake. It will also incorporate other methods that will be non-chemical. The advisory committee reviewed the prescription. They recommended a few revisions to it, which was incorporated into the policy, or not the policy, but the prescription that's coming forward today. The advisory committee deems that the use of a pesticide is necessary for the control work that they're trying to do. but the risk to human health and the environment is considered low. And so they recommend it unanimously for adoption by the county. And Tim Wilson is available from the Lakes Program. He's the Lakes Program and Noxious Weed Coordinator Manager. And he can give you any information specific to the prescription if you don't have any questions for me about the policy and how it's interacted or acted.
Good job. Any questions or comments to any one of them, Tim or Patrick?
Well, I don't know if I've got questions of Patrick or Tim or some of the Lakes folks, but we want to make sure we get it right, so that's.
Okay, and I saw that we do have 2 advisory committee members here today with us as well. So Tim, did you want to come up and talk about the prescription?
Good afternoon.
Good afternoon.
Tim Wilson, I'm the Thurston County Noxious Weed and Lakes Program Manager, and we're just very, very excited to finally have this prescription in front of you. It's the result of considerable staff time, both at Public Works and Patrick's time. So just to drill down a little bit on this prescription and the change that's before you today, as there's already a Long Lake prescription in front, or that's in place, but the 2 main points with this prescription, we're adding a larger treatment area, bringing it in line with the ecology NPDS permit, and expanding the area that we're allowed to treat from 45 to 90 acres. The lake is about 330 acres, so it's still a relatively small portion and in line with state requirements, but it lets us treat a larger area and be a little more thorough in how we manage the lake. The other thing that it does is it adds a 3rd herbicide. We already have 2 herbicides that we were allowed to use that are, time has shown that it's not necessarily the best tools for the species of weed that we're dealing with now, and the environmental situations that are out there, such as high flow areas. And so it adds an herbicide that has a lower contact time, and it increases the treatment area. It's part of an integrated approach, and we're hopeful that you will consider it.
I don't know if any of the Lakes people are going to talk or not. I just don't know. So, no, I'm good.
Any questions?
Yes, just to, these are very simple for you. When you, the prescription you've been using, how long have you been using that to find it's not really working effectively?
Patrick, 2007? 2009.
So this will be the first new prescription, and so you put it together and you test it to see if it's going to work, or you just put it together and chemically hope it's going to work? I don't understand.
Well,
that
for
piece.
the herbicide portion of it, we consulted specialists. We consulted specialists from the Department of Ecology, Jennifer Parsons, who is the State Ecology Lake Management Specialist and is responsible in large part for many lake treatments throughout the state. So she has experience with the new herbicide that we are testing. It also goes through considerable review to be labeled for certain species under certain conditions. So there's a lot of information and data out there that supports that it's going to be a good tool for us to use, and that's why we added it.
Thank you, and that's for me as well as the people that are going to watch this down the road on TCTV to know it's not just hey, let's just put this together and try it.
Absolutely.
And also, each lake is very unique unto itself, and so this prescription wouldn't necessarily work on all lakes. Is that correct?
Well, yes, it is correct. Every lake is a little bit different in Thurston County in terms of the species that we're targeting and the hydrology, the flow through the lake, if there is flow, influence of groundwater. So there's a lot of different characteristics that are out there. This would work in a lot of situations, but not all of them.
No, good. Long live Long Lake.
Long live Long Lake.
I'm done.
I don't have any questions. Thank you so much, Tim. And so I was going to ask Doug, did you want to make a quick remark one way or the other as far as advisory board? No? No? Okay, here he goes. Okay.
Actually, I'm in a little difficult position because I'm on the advisory
And
committee, as well as the president of the Long Lake Management District. So I guess I'll put my Long Lake Management District president's hat on now. And the need for increasing the area that we can treat just gives more flexibility.
Sure.
We can't afford to treat the 90 acres every year, and we have never really had a need to treat 90 acres until last year. So there can be a situation where we might need to do it again, and this gives us the ability to address it, because last year the weeds were so thick that people couldn't even use their property. And that's after we used a harvester and hauled 260,000 pounds of weeds out of the lake.
Goodness
And
gracious.
it still did nothing.
Oh, my
I
God.
mean, yes, it did help, but,
That's crazy talk.
so that's the reason for that need, as well as the need for an additional tool, which is the additional herbicide. But one other thing that the prescription does is it documents or formalizes inspection procedures, so that when the Lakes Management District goes out and inspects the lake to determine what species of weeds in, or how thick they are, how dense they are, how close to the surface, all of those things, it provides a procedure for doing that, which we didn't have before. Before it was, yep, it looks, we need to do that. Well, this
Yeah.
actually says, here's the species, here's the density, here's what makes up the weeds in that area, and so it's just more scientific.
Very good.
So-
Good, very good.
All righty. Thank you so much, sir.
Thank you, sir.
All right, any other questions, comments on this? No, so I'll entertain a motion.
Chair, I move to approve the Long Lake Aquatic Nuisance Weed Prescription.
I'll second that.
It's been moved and seconded to approve the Long Lake Aquatic Nuisance Weed Prescription. All those in favor say aye.
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 Aye. Motion carries. So the next item we have is item number 5, which is the set up public hearing. I'll let Art Story frame it and talk about it.
So, good afternoon, I'm Art Starry. I'm the interim director for the health department and also the environmental health director. And what I'm here today to do is ask you to set a public hearing to consider an ordinance that would repeal the septic system charges that were adopted by the previous Board of Health in 2016. And so as the board knows, in 2016, the on-site septic system management plan was an update of that was adopted in November. And then in December, as part of the county budget process, the Board of Health adopted an ordinance which imposed, or which in 2018 would impose a $10 charge on septic systems in Thurston County, excluding those that are in Henderson and Nisqually. Those are covered by a separate program. And so the ordinance, if it were to stay in place, would, again, require septic system owners to pay a $10 charge per year for each septic system, and that would be charged via the property tax statement. Now, the new board has concerns about that, and so they want to have a hearing to consider repealing that ordinance.
That's $10 additional.
$10 additional dollars.
Okay,
And-
yeah.
Well, and for these folks, it would be a new charge for them.
In some places, yes.
Yeah, and so what this would do is, again, it sets the hearing so that you can consider whether or not you want to repeal that ordinance and that charge. And that's really what the draft ordinance that's been prepared just deals with the charge and the ordinance that implemented the charge. It doesn't repeal the plan. The board or you as the board have indicated that you want additional time to consider that, to look at the plan and consider whether it needs to go forward and how to fund that, if it needs to be funded at all.
Yeah, very well put, exactly.
And so this is again, what you've asked us to do. So there's a draft ordinance that's been prepared and is available for the public. It'll be published online and available at the counters later this week, so people can see it. And what we're asking you to do is to set a hearing that would take place after your April Board of Health meeting at 5:30 in this room. And so, that's basically the point. We've got a hearing notice that's been prepared by our legal counsel and myself. And if you're of a mind to do that, you can set the hearing, and then we'll make this information available to the public, and then you can consider it next month.
Okay, comment? Yeah.
Art, when you mentioned Nisqually and Henderson watershed.
Yes.
What does, when you say Nisqually, does it cover Nisqually Pines, or just down in the valley, or what does that cover?
No, Nisqually covers the Nisqually Reach watershed protection area. And so that Previously, the Board of Health adopted a special septic system monitoring and maintenance program, and it's for the northern part of Nisqually. So it'd be the point going down partway towards Lacey, but it does not get all the way down to Nisqually Pines, or it actually kind of stops at the military reservation. And so that area has in place a special septic system monitoring and maintenance program, and there are charges being that the existing property or the property owners already have to pay. So that program's in place. It doesn't, it stays in place until the end of 20, gosh, I should remember this date. But anyways, for a few more years unless you choose to repeal it as the Board of Health. So what this is, the 2018 program just, it doesn't replace that, it leaves that intact. And this ordinance that that has been drafted doesn't change that existing program. Am I making any sense?
Sure, but what I'm curious about was, I've been talking to you about that Nisqually Pines
Yeah.
area and how we might do something down there and, with new technology. That is not that's no effect on anything.
This doesn't
right?
affect that at
Okay.
all. I made the answer too complex, I'm sorry.
That was it.
Oh, okay, so just for clarity, the plan was adopted last year. This change here for the public hearing on 11 April at 5:30 doesn't address the plan in terms of.
It doesn't, the plan would stay intact, and then, in fact, you've asked us to schedule briefings with you to review the plan.
Yeah.
And then after that, if you decide that the plan needs to be amended or repealed, then that would take a separate action.
Sure, and then maybe even a different fee structure if needed at
Yeah,
that time.
and so, depending on what you feel about the plan, then we can talk about how to fund it if that's appropriate.
Okay, good. Oh, hey, is there a motion?
Mr. Chair, I move to set a public hearing on April 11, 2017 at 5:30 PM or soon thereafter, as the matter may be heard in room 280, building number 1 of the Thurston County Courthouse, to receive public comments on an ordinance repealing ordinance number H-3-2016 dated December 16th, 2016, thereby repealing the rates and charges on on-site sewage systems imposed to fund implementation of the Thurston County On-Site Sewage Systems Management Plan update.
I'll second that. It's a mouthful.
Yeah, it's a mouthful,
I
sorry.
gotta take a break. It's been moved and seconded as stated. All those in favor say aye.
Aye.
Aye, motion carries. Very good. Okay, so we're just gonna jump right into item number 7 on the director's report, and I'm gonna right back to Art Story to see what he has to say.
I don't have a whole lot to report on, other than as I think many people know, there is a new Public Health and Social Services Director is coming at her first day will be March 27th, and that's Shelley Slaughter, and so we're looking forward to that. At this next board meeting, she'll be playing the role of the Health Department Director, and I look forward to that as well. As far as just highlights, there's just a couple of things that I'll mention, and they're more environmental health related. One has to do with the Little Rock Elementary School for the last 2 days was closed because their water supply had a major water line leak. And so the good news is that, well, I guess the good news is that the systems that are in place to kind of make sure that the water supplies work right worked. The school folks appropriately decided that, without water, they shouldn't be operating the school, but they also took action to repair the system quickly, and school should be back in service, be back and running again tomorrow. So that's good news. That actually all happened when I took yesterday off, so I don't know what that means, but I'm glad to see that actually everything works the way it's supposed to, that, again, the people who run the water system and the folks who are responsible for determining when the school can operate or not, they all work together to make a good decision on that. So, again, that was one big thing. The other thing was that we were involved pretty extensively in a recall of soy nut butter that you may have read about in the news. And the health department was involved, again, with schools because the products that were recalled are actually used in quite a few schools as substitutes for peanut butter and other things. And so we wanted to make sure that the school districts were aware of the recall and that they weren't serving any of those products because of the contamination. There are recalls that take place, it seems like every day these now, and most of the time we don't have to get too heavily involved. The federal government and the State Department of Health work very well at notifying folks, and with the data systems in place, the stores know pretty much which products they had and where they went, and when they can pull them off the shelves readily, and it doesn't affect, I mean, it happens kind of behind the scenes and people don't notice it, but in this case, it was a little bit bigger because of the potential effect for schools, and so we wanted to make sure that they were aware of that. So that was another bit of information, or another thing that happened in the last week. Dr. Wood, I'd try to cover for her, but I can't even begin to do that, so I'll just stay off of that for you today.
We worry about the peanut butter anyway, so.
Yeah. So those are just a couple of highlights. I don't have anything else at this juncture.
Okay. Any closing comments and remarks?
Could you give us just a real quick update on that Cherry Point still in the Puget Sound, the sewage spill? Wasn't it Cherry Point up in Seattle?
Yeah.
Have they fixed that, or is it
They're still working on it.
ongoing?
That's so it's the one up at West Point. So there is 300 million gallons of wastewater that were discharged, and it was a catastrophic failure when they had a big storm, and when the stormwater inflow along with the wastewater inflow basically overflowed the plant and got a lot of their electronic controls wet, and the system is. The article I read last week said that the system still wasn't fully functional, and it was going to be some time for it to get back on its feet, which is very concerning, obviously. We're fortunate that I think we've not had anything like that down here. In fact, I think Commissioner Hutchings can probably talk about this if he wanted to. Last week, at the lot board meeting, they talked about during that same storm event how the lot folks were managing flows and controls to make sure that they didn't have any major releases of untreated sewage like that. So I think we're very fortunate that we've got a well-run facility, and we've been able to avoid that. And I think avoid isn't the right word, but they've planned for and they work really hard at making sure the system runs properly. So that's good news for us. And they're also looking at the operation of that facility, is trying to take into account when they rebuild things, and looking at how, if there's sea level rise and all that, how they can manage that to minimize the chance. But I gave you a bit more information than you asked for, but the problems in Seattle are still continuing, which unfortunately they don't have that totally under control yet.
They were absolutely overwhelmed with the surge of water, and some type of one part in their system, almost like the floater valve in your toilet tank, didn't function. And so warnings weren't sent out and such preliminarily. And now it's turning into a hot potato, because I think the council wants an independent investigation as to what's going on. It's as ugly as what's being released into the sound.
By Victoria or something?
Yeah.
You probably knew I couldn't not say that, right?
But I'm exceptionally pleased with the way Lot responded to that storm, because everybody was hit with the same doggone water. But go ahead.
Well, no, my concern is that we not have that same thing happen here.
Yeah,
So
no, I
I'm
mean, obviously
hoping
that's.
you can assure us of that.
Well, I mean, I think they're doing what they can, to manage things. And I think our lot facility is very well managed, and they are do keep an eye on trying to look at things. They're routinely bringing things to the board of directors for a lot about, maintenance and looking to the future. I think there were a bunch of items last week, for instance, that they're talking about upgrading some of their treatment facilities. And one of the things they always look at are the controls and things, because if they get wet, you got a problem. And so they're looking at how to make sure that doesn't happen and that things operate properly. Yeah, and I probably shouldn't say a whole lot more, because I'm getting a little bit out of my field of expertise, but I do know they're very conscientious about that.
Okay. I just think it's a big concern. I know we had something in January.
We fussed.
Something similar, wasn't it? Nothing similar to that, but I mean, we had some valve malfunction over in Tumwater or something.
Right, and so we've had some, we have had some mishaps within the county or the cities, and I think that's, when you have pumps and controls and stuff, sometimes you can have mistakes. But the good news is they were found pretty quickly, and folks stepped in. Not literally, but stepped up. And I wasn't even trying to make a pun, and it just happened.
So dry, your humor.
But folks stepped up to check on things. They did monitoring. They notified neighbors. They made sure that they evaluated the possible impacts of the wastewater discharge. and have been very responsible about that. Again, it wasn't 300 million gallons, but I think the folks are very responsible in the cities. There's another little thing that happened with Olympia the other day, and I get a phone call at 5:30 at night, and they're saying, here's what's going on, here's what we're doing, what, is there anything else we need to do? I mean, they're on top of it, and they do a good job. So I think we're very fortunate that we've got very responsible folks and I think we work very collaboratively. The cities and the public health department have done a good job of saying, okay, well, here's our roles in these things, here's how we need to be involved, here's who needs to be notified. And so I think, again, the good news, we've avoided anything really big, but the things that have happened, we've been able to make sure we're doing the right thing to protect public health and protect the interests of our citizens.
Okay,
That's it.
good.
How about you?
No, I'm very impressed with the protocols that they have in place.
Yeah, no,
and
I think they do a
notifications
very
that
good
go out.
job.
Yeah, those are done.
I'll take a motion to adjourn.
Mr. Chair, I move to adjourn the Board of Health meeting of March 14, 2017.
I'll second that.
It's been moved and second to adjourn the Board of Health meeting for March 14th, 2017. All those in favor say aye.
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 Aye. Motion carries. We are adjourned.
Okay, thank you.
Thank you.